This test has 3 parts. In each part, you will hear a number of different extracts. At the start of each extract, you will hear this sound. You will have time to read the questions before you hear each extract, and you will hear each extract once only. Complete your answers as you listen. At the end of the test, you will have 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for extract 1. Extract 1. Questions 1 to 12. You hear a GP talking to a patient called Joshua Ferguson. For questions 1 to 12, complete the notes with a word or a short phrase. You now have 30 seconds to look at the notes.
Hello, Mr. Ferguson. How are you feeling?
Not so good. I'm not able to sit still, and the pain is so bad. It woke me up again last night.
Oh, sorry to hear that. The analgesia we've given you should take effect very soon. In the meantime, can you give me a bit more information in addition to the consultation that we had earlier? Have you had any other symptoms?
Yeah, I have. I vomited dark green liquid about 4 times.
Okay, you vomited. But have you had any unusual bowel movements? Diarrhea, rectal bleeding?
No, I haven't.
Any pain from your loin to your groin or increased urination?
Yes, the pain has spread. I also pass urine more frequently, around 5 times per night now.
Do you have any previous conditions like appendicitis or irritable bowel syndrome?
Yeah, I have irritable bowel syndrome and take mebivarine. I also take an all-in-one multivitamin. I'm not sure about the other one. What is it, appendicitis?
Appendicitis is a painful swelling of the appendix, which is a small thin pouch about 5 to 10 centimetres, and is connected to the large intestine where stools are formed.
Oh, and what causes that?
Appendicitis typically starts with a pain in the middle of your tummy that may come and go. And within hours, the pain travels to the lower right-hand side, where the appendix usually lies, and becomes constant and severe. Pressing on this area, coughing or walking may all make the pain worse. You may lose your appetite, feel sick, and occasionally experience diarrhea. It usually requires an operation to remove the diseased appendix.
I see. No, I don't think I've had that before.
Have you had a recent colonoscopy?
I'm not sure. What is that?
A colonoscopy is a test that uses a narrow, flexible telescopic camera called a colonoscope to look at the lining of your large bowel. The doctor would have inserted the camera through your back passage?
Yes, I remember that. They said it was normal?
Good. A few more questions, if I can. Do you smoke, drink, or take any recreational drugs?
Yeah, I smoke 10 cigarettes a day. I drink whiskey socially, about a small glass every week or so. I haven't taken any recreational drugs for about 20 years. I used to in my early 20s, but didn't everybody.
Okay, thank you. Regarding your examination, your temperature was slightly raised, 37.5 degrees, but all of the vital signs were normal. There's obvious severe loin tenderness on the left side. Now, the test came back and showed a high white blood cell count and positive for microscopic amounts of blood in your urine. Taken together, your signs, symptoms, and investigation results suggest a diagnosis of renal uretic colic. But it could be several other diseases we need to rule out.
But what is causing the pain?
The pain, which we believe is renal colic, is caused by the dissension of the tube that collects urine from the kidney, because the kidney stone is lodged inside. The resulting pain normally spreads and can cause the symptoms that you described of increased urination and urgency.
Is that why you took the X-ray?
Yes, and the results should be back shortly. Approximately 90% of urinary tract calculi or stones may be seen on an X-ray. If the X-ray shows complete obstruction, I would like to admit you, especially as we already have evidence of infection in your blood, that is to say, raised temperature, raised white cells, and the analgesia we've given you doesn't seem to have worked very well.
Extract 2. Questions 13 to 24. You hear an obstetrician talking to a patient called Gabby Simcox. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Gabby.
Hi, Dr. Stevenson. How are you?
Good. Congratulations on your pregnancy.
Thank you.
Yeah. So now I'm one of the obstetricians here. You'll probably be seeing quite a bit of me during your pregnancy.
Do I see you each time, or will there be a few obstetricians?
Well, there are a few obstetricians here, but usually, yes, you would see me each time.
Okay.
Just depends on which days and who's about. Yeah, it'd probably be me.
Okay, great.
So I've had a look at your file, and I'm here to answer any questions that you might have, and generally just to help you through your pregnancy, okay?
Thank you. I do have a lot of questions.
Well, I can see that.
Yeah.
Fire away.
Great.
So now this is your first pregnancy.
Yes, it is.
Okay, so just to clarify, you've had no miscarriages, because sometimes people don't consider these as well.
No, I haven't.
Okay, so now just with your due date and things, let me just find out, when was the first day of your last menstrual period?
It was about the 24th of March.
Okay, and do you have a regular cycle or an irregular cycle?
Yeah, no, it's regular.
Okay, it's regular. How many days?
About 27?
Okay, that's fine. I mean, we'll work that out for you and we'll give you an exact date. Can I just make sure, has your midwife arranged your 8-week ultrasound already?
Yeah, we had that, although I don't know if it was 8 weeks. Let me just think. It was Mum's birthday on the 1st, so actually, yeah, it would have been about 8 weeks.
Okay, so we'll get the results of that and we'll also give you an accurate date.
For the due date, yeah?
Yes, the due date as well.
Okay, so how often is it actually on the due date?
Hardly ever.
Hardly ever, okay.
I mean, it's not, it can happen, but it's very rare.
Okay, so before?
But your due date's actually a month, so anywhere from 37 to 42 weeks. So the due date is really definitely an estimate.
Okay, so really it's kind of 2 weeks either side of the due date.
2 weeks either side of the due date.
Okay.
And any problems at all falling pregnant? You had no fertility problems?
Well, I'd been on the pill for about 12 years or something, and we thought it would take a long time, perhaps. But when I went off it,
Sure.
Yeah, the first month.
Okay, yeah, that's fine. So I can see from your file that you have a family history of diabetes.
Yes.
But you don't have a history of any hypertension or cystic fibrosis.
Nope.
Okay. The allergies part in your file was blank. Are there any allergies we should be aware of?
Yeah, actually, I'm allergic to nuts.
Okay, just peanuts or all nuts, do you know?
I'm not sure actually, but to be honest, I just tend to avoid all nuts.
Okay, I'll add that to your file.
Thank you. Yeah, so one thing that I had wanted to mention is that I recently found out my blood type is Rhesus negative.
Okay.
Yes, so I just wanted to talk about that a little bit because I have heard that it can be dangerous if my blood mixes with the baby's blood, if the baby's blood is different to mine.
Have you had any bleeds?
No, I don't think so. Is that something that I should be looking out for?
Yeah, certainly. Look out for bleeds, and they'll also pick it up in your scans. If you notice any bleeds and if the blood is bright red, come to the hospital immediately for treatment. We'll give you an injection called anti-D, and it will essentially prevent any harmful effects to the baby.
Okay, so an injection of anti-D, that's all I need to do then?
At this stage, yes.
This is the end of Part A. Now, look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen. Complete the answers as you listen to the audio. Now, look at the question 25. You hear a discussion between a doctor and nurse about different types of blood tests for leukemia. Now, read the question.
Hello, doctor. What are the different types of blood tests for leukemia?
Well, blood tests, such as complete blood count, can detect leukemia. A complete blood count determines the number of red blood cells, white blood cells, and platelets. Cytogenetics analysis is a blood test in which a sample of blood is examined to check for changes in the chromosomes of the lymphocytes. Peripheral blood smear determines the presence of blast cells and shows the type and quantity of white blood cells. Other various blood tests may be ordered to see how organs are functioning and if they're being affected by leukemia. Question 26. You hear a discussion about different types of melanoma. Now, read the question. There are 4 major types of melanoma that have the potential for metastitis, with distinct characteristics. Lentigo maligna is often found on the head and neck region. Superficial spreading melanoma is more commonly found on the trunk, upper arms, and thighs, and is the most common form of melanoma in white races. Acrolatiginous melanoma is more commonly found on the hands, feet, and nail beds, which is similar to lentigo maligna and superficial spreading, in which it has a relatively long, flat phase before it penetrates into the deeper levels of the skin. Nodular melanoma can occur on any skin surface, but is found more commonly on the trunk, upper arms, and thighs. Question 27. You hear a discussion about lung cancer. Now, read the question.
Hello, doctor. What are the different types of lung cancer?
Squamous cell carcinoma, or epidermic carcinoma, usually starts in the bronchial tubes in the center of the lungs and can cause symptoms early on, especially hematypus. Large cell carcinoma often occurs in the outer regions of the lungs and tends to grow rapidly. Mesothelioma actually begins in the mesothelium, a membrane that surrounds the lungs. Small cell lung cancer usually grows in the central areas of the lungs, and most people have few symptoms until just before they are diagnosed. Lung carcinoid tumors are made up of cells called neuroendocrine cells. Question 28. You hear a discussion about non-inflamed comedones. Now read the question.
Hello, doctor. Can you please explain to me what are non-inflamed comedones?
With non-inflamed comedones, there will not be redness or swelling of the lesion. However, non-inflamed comedones may turn into a pimple when bacteria invade. Open comedones, or blackheads, is an accumulation of dead skin cells and sebaceous matter within the follicle. Soft-closed comedones develop when a plug of cellulose debris and oil becomes trapped within the pore and are covered by a layer of dead skin cells. Hard-closed comedone, called milia, have very obvious whiteheads, which is not pus, but rather a mass of dead cells and sebum. Microcomedones occur when the sebaceous duct and pore opening becomes blocked by excess sebum and dead skin cells. Every blemish begins as a microcomedone. Question 29. You hear a question about acnes. Now read the question.
Hello, doctor. Could you explain to me what are acnes?
Well, there are different types of acne which are not just classified by its severity. Acne vulgaris can appear on the face, back, shoulders, and buttocks. If you break out, most likely it is the acne vulgaris comedomal acne. Appears as bumpiness, blackheads, which can occur anywhere on the face or body that can range from very mild to quite severe. Cystic acne is the most severe form of acne, which can occur anywhere on the face or body. Acne cysts occur deeper in the skin than the typical pimple, take weeks to heal, and can cause a lot of damage to the skin. Because they are so deep, topical acne treatments are not very effective. Instead, oral medications, like Accutane, are the best option. Nodule acne is another severe type of acne vulgaris. Acne rosacea is a type of acne that affects adults above 30 and occurs only on the face. Acne machantia is caused when there is excess heat, pressure, or friction on the skin. This type of acne is most common on the body, but can also occur on the face. Acne cosmetica is caused by products like creams, makeups, and moisturizers, and even certain hair care products cause this type of facial acne. People with excoriated acne chronically and excessively pick at pimples to the point of causing wounds. Question 30. You hear a discussion about athlete's foot. Now, read the question.
Hello, doctor. What are the different types of athlete's foot?
Athlete's foot is divided into three categories: chronic interdigital athlete's foot, chronic scaly athlete's foot, and acute vestibular athlete's foot. Chronic interdigital athlete's foot is characterized by scaling, maceration, and fissures, most commonly in the webbed spaces between the fourth and fifth toes. With this type of athlete's foot, itching is typically most intense when the socks and shoes are removed. Acute vesicular athlete's foot is the least common type of athlete's foot, caused by trichophyton mentagrophytes, that is characterized by the sudden onset of painful blisters on the sole or top of the foot. This type of athlete's foot is also caused by jungle rot, a historically disabling problem for servicemen fighting in warm, humid conditions. Chronic scaly athlete's foot is caused by Trichophyton rubrum. This dermatophyte causes dry, scaly skin on the sole of the foot. The hands may also be infected, although the usual pattern of infection is 2 feet and 1 hand, or 1 foot and 2 hands, and these are most commonly seen in patients with eczema or asthma. This is the end of Part B. Now, look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer, A, B, or C, which best fits according to what you hear. Complete the answers as you listen to the audio. Now, look at Extract 1. Extract 1, for questions 31 to 36. You hear the lecture given by a physician on the standard method of diagnosing attention deficit hyperactivity disorder. You have 90 seconds to read questions 31 to 36. The standard methods of diagnosing and assessing attention deficit hyperactivity disorder used by mental health professionals is application of the criteria established in the Diagnostic and Statistical Manual for Mental Disorders that identifies 3 presentations of attention deficit hyperactivity disorder: combined presentation, predominantly inattentive presentation, predominantly hyperactive impulsive presentation. Functional neuroimaging, such as SPECT scanning, is considered an effective tool for researchers. Type 1. Classic attention deficit disorder. People with classic attention deficit disorder have reduced blood flow in their brain area of the prefrontal cortex, cerebellum, and basal ganglia. The basal ganglia produces dopamine. Type 2. Inattentive attention deficit disorder. People with inattentive attention deficit disorder are often described as daydreamers, space cadets, and couch potatoes. This type is more common in girls than boys and is often diagnosed later in life because people with type 2 inattentive attention disorder don't have behavioral problems. People with this disorder have reduced activity in the prefrontal cortex as well as low levels of dopamine. Type 3. Over-focused attention deficit disorder. People with over-focused attention deficit disorder have a deficiency of dopamine and serotonin. The aim of treatment is to increase both these neurotransmitters, the nervous system's chemical messengers. Type 4. Temporal lobe attention deficit disorder. People with this type might see or hear things that are not there, and learning and memory problems may be present. The patients will have irregularities in their temporal lobes and less activity in the prefrontal cortex part of the brain. The aim of treatment is to soothe neuronal activity and stop nerve cells from overfiring or firing unpredictably. Type 5. Limbic Attention Deficit Disorder. People with limbic attention deficit disorder have excessive activity in the limbic section of the brain, which is where moods are controlled. They have reduced activity in the prefrontal cortex, both when relaxing or focusing on a task. Type 6. Ring of Fire Attention Deficit Disorder. People with Ring of Fire Attention Deficit Disorder have an overactive brain. There are excessive amounts of activity in the central cortex and other areas of the brain. Type 7. Anxious Attention Deficit Disorder. People with anxious attention deficit disorder have high levels of activity in the basal ganglia that aid in making dopamine. This differs from the majority of the other attention deficit disorder types, which have low activity in this part of the brain. It is possible to have more than one of these types of attention deficit disorder. For example, a common combination is overfocused, limbic, and anxious types. Now look at extract 2. Questions 37 to 42. You hear the monologue of a physician giving a lecture on scleroderma. You have 90 seconds to read questions 37 to 42.
Hello, doctor. Could you please explain different types of scleroderma?
Well, scleroderma is a symptom of a complicated group of diseases by an abnormal growth of connected tissue that supports the skin and internal organs. This disease is also termed as systemic sclerosis. Scleroderma literally means hard skin, derived from the Greek words sclerosis, meaning hard, and derma, meaning skin. Scleroderma is considered both rheumatic disease, since the conditions are characterized by inflammation and pain in the muscles, fibrous tissues or joints, and a connective tissue disease. Certain types of scleroderma have a limited abnormal process that primarily makes the skin hard and tight. Other types are more complicated, affecting the internal organs, such as the lungs, heart, and kidneys, and the blood vessels. A phrase identified as softening occurs, during which less collagen is produced. There are two main classifications of scleroderma. Localized scleroderma, that affects only certain parts of the body, that includes linear scleroderma and morphea, and systemic sclerosis, that affects the entire body. Localized scleroderma. Localized scleroderma affects the skin and related tissues, and at times the muscles below. However, internal organs are not affected. Localized scleroderma can never advance to the systemic type. Moreover, localized types can improve over time. However, the skin changes that occur during the disease can be permanent. It may be serious and disabling. Morphea. Reddish patches of skin that thickens into firm oval-shaped areas are distinctive characteristics of the morphea type. The centers of the patches appear ivory with violet borders. The patches occur on the stomach, chest, face, back, legs, and arms. Typically, these patches sweat a little and have little hair growth on it. Morphea can limit to one or several patches, ranging from a ½ inch to 12 inches in diameter, or else it can be hard and dark, spreading over larger areas of the body. Morphea generally fades out in about 5 years. However, people can have permanent dark skin patches and muscle weakness. Linear scleroderma, characterized by a distinctive single line or band of thickened, abnormally colored skin. Typically, the line runs down an arm or leg and can run down the forehead. Systemic sclerosis not only affects skin but also involves blood vessels and major organs. Patients with systemic sclerosis often have all of the following symptoms, known as Kress syndrome, an acronym for calcinosis, formation of calcium deposits in the connective tissue. Raynaud's phenomenon. Small blood vessels of hands or feet contract in response to cold or anxiety. Esophageal dysfunction. Impaired function of the esophagus occurs when smooth muscles in the esophagus lose normal movement. Sclerodactyly. Thick and tight skin on fingers result from deposits of excessive collagen within skin layers. Cholangiotaceus. Small red spots on the hands and face are caused by swelling of tiny blood vessels. Systemic sclerosis is further divided into two categories, called limited and diffuse. Typically, limited scleroderma has a gradual onset and is restricted to certain parts of the skin, such as hands, fingers, lower arms, face, and legs. Often, Raynaud's phenomenon is experienced for years before skin thickening becomes evident. Calcinosis and cholangiotaceus often follow. At times, limited scleroderma is referred to as Kress syndrome because of the predominance of Kress symptoms in these patients. Typically, diffuse scleroderma has a sudden onset. Skin thickening develops quickly and covers much of the body in a symmetric pattern. Most of the internal organs can be damaged. Skin can swell, appear shiny, and feel itchy and tight. The damage of diffuse scleroderma occurs over a period of a few years. After a period of 3 to 5 years, patients tend to stabilize, a phase when progression of the disease seems little and symptoms subside, but gradually. Skin changes begin again. A phase identified as softening occurs, during which less collagen is produced and the body rids of excess collagen by itself. This is the end of Part C. You now have 2 minutes to check your answers.